Welcome to RAAONLINE. I am Dr. Vetrichelvan, Critical Care Consultant from Kaveri Hospital. Today we are going to see about non-invasive mechanical ventilation. First, that why we need when you need to understand the non-invasive mechanical ventilation. Because we are using the non-invasive ventilation, not only the critical care consultant, it is used by all medical professions like intensive care medicine or pulmonologist or persons giving that rehabilitation therapy in outside of the hospital. So when you see here in this retrospective study, 1 out of 4 patients are received inadequate non-invasive mechanical ventilations, which means that these are the complications related to non-invasive mechanical ventilations are preventable. So the better understanding of the non-invasive mechanical ventilation, like physiological understanding, which patients we can use, selecting a right patient and right ventilator settings, and what are the advantages of non-invasive mechanical ventilation over the invasive mechanical ventilations. First thing is that decrease the incidence of infections with the non-invasive mechanical ventilation. We all know that the incidence of VAP are higher with invasive mechanical ventilation than the non-invasive mechanical ventilation. The second thing is that if the patients on invasive mechanical ventilation have a higher risk to develop a ICU acquired weakness and increased delirium with the invasive mechanical ventilations. So if you avoid the invasive mechanical ventilation, we can decrease the incidence of VAP, decrease the incidence of ICU acquired weakness, decrease delirium with the non-invasive mechanical ventilation. The second thing, if you put a patient on invasive mechanical ventilation, patient need to be in ICU, patient need to be monitored in the ICU, the physician who understand the invasive mechanical ventilation. But in non-invasive mechanical ventilations, need a lesser expert. So it can be managed in the ward in high defining unit, sometimes patient on non-invasive mechanical ventilation in the home and rehabilitation center. So first, before going to see about non-invasive mechanical ventilation, we all should know what are the 2 types of ventilator which provide the non-invasive mechanical ventilation. One is ICU ventilator, that is called critical care ventilator. Second is the home BiPAP or portable BiPAP. We will discuss in the later. Second, what type of mode preferable with the non-invasive mechanical ventilation? Most traditionally we are using the pressure control mode. The reason why we are using the pressure control mode, because the volume control mode, it is a very unsafe to deliver a high peak airway pressure in the unprotected airway. With volume control mode, there are more asynchrony. Patient won't be comfortable with the volume control mode. There is increased gaseous distension. So these are the limitations with the volume control mode. So we will go, whenever we are using the non-invasive mechanical ventilation, we will use with the pressure control mode or pressure support mode. Pressure control mode also has some limitations like leak related. Some intolerant of mask leak, it leads to frequent alarm, leak related asynchrony like cycle asynchrony, delayed trigger, delayed cycle. All these complications can occur with the pressure control mode. So the most traditional management to prevent the leak related complications are tight the mask. But it makes the patient more uncomfortable. Patient may cooperate with this at non-invasive mechanical ventilation. It leads to NIV failure. So for prevent this mask related complication, lot of things are changed with the mask and with the ventilator in the recent last 10 years. We will see all those things in the later. First thing that I already told, there is 2 types of ventilators are there. One is the critical care ventilators. One is NIV ventilator. The critical care ventilators, there is the first one is a critical care ventilator. What critical care ventilator? It can provide invasive mechanical ventilation and also non-invasive mechanical ventilation. Second thing is the NIV ventilators. It's called portable small BiPAP. It can only deliver a non-invasive mechanical ventilation. If you see the advantages, we will see which condition we can use the critical care ventilators, which condition we can use the non-invasive ventilator. First, we will see the critical care ventilators. We see the critical care ventilator. The first advantage of the critical care ventilator is we can use the high FiO2. We can titrate the FiO2. We can give the fixed FiO2. So, for example, the patient require high FiO2 requirement like 70%, 60% and 100%, we can provide with the critical care ventilators. So the indication for critical care ventilator is patient whoever requiring high FiO2, in those situations will go with the critical care ventilators. Second is that see here compared to this portable BiPAP machine and with critical care ventilators, here the additional monitors here. So in these monitors, we can see these monitors will provide the flow waveform or pressure waveform or volume waveform. From these waveforms, we can understand what is going on in the patient's lung, how the patient's lung is reacting to our ventilatory support. So, which are the clinical condition? These waveforms are essential. If example, patient comes to you with severe acute exacerbation of COPD, in those conditions, there are ventilator-related complications will occur, like auto PEEP. In those situations, we need to monitor the flow waveform. So, there is a two condition. One is severe hypoxic patient requiring NIV, so we'll go with the critical care ventilators. Our second one is the patient need to be monitored closely. Example, severe acute exacerbation of COPD. These are the two conditions. We will go with the critical care ventilators. What are the disadvantages of critical care ventilators? You can see here, these critical care ventilators are less leak tolerance compared to the NIV ventilator. The other thing is that is a compactness and the patient's comfortness with actually better with the NIV ventilators compared to the critical care ventilators. So, what are the advantages of NIV ventilators? These ventilators is the most common adverse effect with the NIV mask is that leak. So, which leads to unnecessary asynchrony or the inadequate ventilations. So, the NIV ventilator, that is a small portable ventilators, are better with the leak throttle. It compensates the leak with the NIV mask. Second thing is that they have smaller machines which can be used in the out of ICU also. For example, ward, in that rehabilitation center, sometimes we can use in the home care also. So, these are the advantages. Critical care and ventilators are absolute indication for the two clinical conditions. You want to give the higher FiO2. Second thing, the patient need to be closely monitored. NIV ventilators especially will use for the out of ICU care like rehabilitation center or ward, or patients need home NIV support. All those settings we can go with the NIV ventilators.